Thank you for listening to this presentation about the Nebraska Medicaid Substance Use Disorder State Plan Amendment regarding the new opioid treatment program, providing Medicaid reimbursement for community-based addiction treatment for opioid use disorder. By the end of this presentation, you should be able to understand the requirements of an opioid treatment program in Nebraska, identify the list of billing codes available for reimbursement, and identify the basic requirements for provider enrollment and MCO credentialing, and know where to find additional information on those processes. To achieve these objectives, we will discuss the following topics in this presentation: definition and desired outcomes, setting of care and facility license, staffing requirements, admission criteria, length of service, continuation of treatment, service expectations and required assessments, Medicaid billing and reimbursement, provider enrollment and MCO credentialing, and considerations for dually enrolled individuals. Nebraska's State Plan Amendment was approved by CMS on November 3, 2020, which means that services for opioid treatment programs and medically monitored inpatient withdrawal management will be included as billable services in the Nebraska Medicaid benefit set. A separate presentation is available to cover the details of the medically monitored inpatient withdrawal management programs. Fee schedules for mental health and substance use, A1 and A2, effective September 1st and July 1st, 2020 respectively, are available online on the DHHS website. Eligible providers can bill retrospective to date of service on or after January 1st of 2020. You can access the full opioid treatment program service definition from the DHHS website. The state defines an opioid treatment program, or OTP, as a program that offers community-based outpatient addiction treatment compliant with federal regulations for individuals diagnosed with an opioid use disorder, as defined in the DSM and meeting ASAM criteria for care placement as determined by a practitioner. Opioid treatment programs administer medications approved by the FDA to treat opioid use disorder and alleviate the adverse medical, psychological, and physical effects incident to opioid addiction. Medications are provided in conjunction with rehabilitative and medical services. The desired outcomes for individuals receiving treatments at OTPs include the elimination of an individual's use of opiates that hinder their recovery and/or ability to achieve and improve the level of functioning for major life tasks. Additionally, an individual achieves remission of target symptoms, and symptoms associated with opioid use are mitigated. Lastly, an individual receiving treatment at an OTP should create a relapse prevention and discharge plan with appropriately licensed staff. The OTP setting is defined as a facility-based outpatient addiction treatment clinic. Each facility must be a Substance Abuse and Mental Health Services Administration certified treatment center that meets the regulatory requirements as outlined in 42 CFR 8, be a license as required by the DHHS Division of Public Health, and be an active enrolled provider with Nebraska Medicaid. There are several staffing requirements that must be met within an OTP. First, OTPs must be staffed according to the SAMHSA federal regulations. OTPs must have a qualified physician responsible for ensuring the program adheres to all requirements, provides all required services, and ensures any other identified services are available. Additionally, OTPs must also have a physician responsible for administering all medical services. The following licensed medical professionals are eligible to administer medications: physicians, PAs, APRNs or RNs, and LPNs under the supervision of a program physician. OTPs are also required to provide therapeutic services delivered by a licensed or provisionally licensed provider. These may include licensed or provisionally licensed psychologists, licensed or provisionally licensed mental health practitioners, licensed independent mental health practitioners, and licensed or provisionally licensed drug and alcohol counselors. This slide outlines the admission criteria for OTPs. To be admitted to an OTP, an individual must meet the diagnostic criteria of opioid use disorder defined by the most recent version of the DSM and meet the criteria for OTP in each of the following dimensions from the ASAM. The length of service in an OTP is based on an individual's medical need to achieve stabilization and prevent relapse. The table on this slide displays the 6 ASAM dimensions for service planning and treatment at the OTP level of care. Dimension 1 explores the acute intoxication and/or withdrawal potential of an individual. This means evaluating a patient's past and current life experience of substance use and withdrawal. An example finding for a patient meeting the OTP level of criteria in this dimension is that a patient has psychological dependence needing OTP. Other examples can be found in the remaining rows of this table. OTP providers should continue to review the current ASAM dimensional criteria for admission to the OTP level of care. Once an individual is admitted to care, an OTP must be able to determine if it is appropriate to retain the individual at the present level of care. For the continuation of treatment at the OTP level, an individual must be making progress but did not achieve the goals articulated in their individualized treatment plan. Thus, continuing treatment at this level of care is necessary in order to permit the individual to continue to work toward their treatment goals, and an individual must continue to meet program admission criteria. Thus, a different level of care is not appropriate. Or, the individual must be experiencing symptoms of such intensity that, if discharged, they would require a more intensive level of care and/or result in increased utilization of acute care services, such as an emergency department visit or inpatient admission, or subject the individual to longer-term risks, such as relapse or deterioration of functioning. In order to initiate treatment at an OTP, there are several service expectations related to assessments, treatment, medications, and other services that must be met. First, we will review the expectations related to assessments. Upon admission to an OTP, an individual must receive a substance use assessment. If that individual has a comorbid condition, then they must also receive an initial diagnostic interview, either in-house by the OTP or by a referral. An individual must also receive a physical examination within 24 hours of being admitted. Now, let's look at each type of assessment in more detail. Each individual must have a comprehensive substance use assessment documented by a licensed medical professional and/or a licensed therapist operating in their scope of practice that indicates opioid use disorder of sufficient severity for an OTP. Any nationally accredited substance use disorder screening instrument can be used to fulfill this requirement. An OTP could use a previously documented assessment result to fulfill this requirement if the prior assessment is clinically relevant, includes a current diagnosis, indicates a level of care recommendation, and outlines a discharge plan. A substance use addendum should be completed if determined to be medically necessary. Assessments and addendums must be completed by a licensed medical professional as described under staffing. After receiving a substance use assessment, individuals with a known or suspected co-occurring mental health disorder must also receive an initial diagnostic interview performed by a licensed practitioner who is able to diagnose and treat major mental illness within their scope of practice. These practitioners include physicians, PAs, APRNs and nurse practitioners, licensed psychologists, and licensed independent mental health practitioners. After receiving a substance use assessment and, if applicable, an initial diagnostic interview or referral, all individuals admitted to an OTP must receive a physical health assessment within 24 hours of admission by a physician, PA, or APRN. The physical health assessment must include a medical history, physical exam, and a toxicology screening, and investigate other medical conditions when relevant to care. Providers are required to meet the clinical best practices for medication utilization and toxicology screening. The next element of OTP service expectations relate to key services and treatment plans. All OTPs must prescribe FDA-approved medications to treat opioid use disorder and alleviate adverse medical, psychological, or physical effects, and they must provide rehabilitative and medical services in conjunction with medications. These key services must be reflected in all treatment plans. Treatment plans are not indicated to be static, but are phased in and reviewed during treatment. First, an individual must receive an initial treatment plan, which equates to a patient's initial assessment created before admission. Within 30 days of admission, a patient must have a comprehensive treatment plan. That comprehensive plan must then be reviewed and adjusted as needed every 90 days or after any significant clinical change. All treatment plans must include discharge criteria and include urine drug tests for individuals in treatment and maintenance. The provision of medications is one of the key services of OTPs. Programs should prescribe medications to treat opioid use disorder and alleviate adverse medical, psychological, or physical effects. OTPs must be able to dispense and administer medications on site daily. Physicians, PAs, or APRNs must prescribe the initial dose and dosing schedule for each patient, which should then be communicated to licensed staff dispensing or administering treatment. Dispensing is only allowed by licensed medical professionals. If the OTP is licensed as a community pharmacy, a pharmacist can dispense. If the OTP is licensed as a public health clinic, holding a current delegated dispensing permit and following Nebraska Statute 38-2884, then the following medical professionals can dispense medications without the on-site services of a pharmacist, including physicians, PAs, APRNs, RNs, or LPNs. OTPs must discuss all FDA-approved options with the individual and customize the choice of medication-assisted treatment to the unique needs of the individual according to the evidence-based practice for treatment of opioid use disorder. OTP providers are expected to stay up to date on FDA-approved medication lists for treatment of opioid use disorder. Current FDA-approved medications include, but are not limited to, intramuscular Vivitrol, oral form methadone, levomethadyl acetate, and buprenorphine, including combination products approved for use in the treatment of opioid use disorder. OTPs should provide rehabilitative services in conjunction with medications, including therapy, care coordination, and sustained recovery. Therapy services offered include individual, group, and family therapy to address the symptoms of addiction and related impaired functioning. Care coordination should be a collaborative process that implements, monitors, and evaluates options and services required to meet the client's needs. Coordination should include referrals to outside services if the OTP does not offer needed services. OTPs must also provide non-residential, outpatient sustained recovery for opioid use disorder, including methadone and buprenorphine, as needed by the individual receiving those services. OTPs and OTP providers must establish a plan of care with a clinically appropriate maintenance period that is based on assessments of withdrawal symptoms using standardized scales and evidence-based practice. Maintenance medications for opioid use disorder should be evidence-based and according to the ASAM standards of care. Now, let's review the Medicaid billing and reimbursement details related to the OTP program. Most services will be reimbursed by the individual's managed care organization. Fee schedules, as noted previously, are available online and are already effective. Eligible providers can bill retrospective services from January 1st, 2020 and after, and the individual's primary diagnosis code must be substance use disorder. The table on this slide displays the procedure codes and rates for OTP services. Procedure codes for OTP services follow the Medicare billing structure with codes G2067 through G2080, and the two new codes for 2021, G2215 and G2216, listed out below. The second column displays the short service description for the corresponding G code. The third and fourth columns indicate the associated rates for 2020 and 2021, depending on the date the service occurred. And finally, the fifth column displays the unit description, followed by the provider type, 51, and provider specialty, 26, for OTP services. Specific instructions on how to enroll as an OTP provider can be found online on the Maximus website. Additionally, providers at an OTP must be accredited by an SAMHSA-approved accreditation source. The services must be provided in a SAMHSA-certified facility, and the facility must be licensed as required by the DHHS Division of Public Health. OTPs must also be credentialed with Nebraska's MCO network. Eligible practitioners who are already contracted, credentialed, and enrolled with the MCO's networks do not need to go through another separate credentialing process, unless they are due for recredentialing. These credentialed and contracted practitioners in network need to submit a new enrollment request to be set up under the identified provider type and provider specialty associated with these services if the currently enrolled NMC provider type, per the Maximus file, does not align to the final provider type published for OTP services. If the group practice the practitioner is part of is not currently contracted, credentialed, and enrolled with the MCO, practitioners enrolled with the Nebraska Medicaid program would be subject to the standard credentialing and contracting process. If the group practice is contracted with the MCO, but the practitioner is not enrolled with the MCO under the group practice, the new enrollment process identified above would need to be followed. For additional information on MCO credentialing and contracting, providers may review the websites on this slide. We will review some special considerations for dually eligible beneficiaries and for COVID-19. Starting on January 1st, 2020, Medicare became the primary payer for OTP services provided by Medicare-enrolled OTP providers for dually eligible beneficiaries, meaning beneficiaries enrolled in both Medicare and Medicaid. OTP providers cannot submit claims to Medicare or receive payment, or even a denial of payment from Medicare, unless they are enrolled in the Medicare program. Newly Medicare-enrolled OTP providers can get a retrospective billing date for up to 30 days prior to the effective date of their Medicare enrollment, but no earlier than January 1st of 2020. For more information about OTPs in Nebraska, please submit your questions to dhhs.medicaidsud@nebraska.gov or visit our website. The following ASAM and SAMHSA resources were used to create the service definition criteria. Please note the ASAM criteria are utilized throughout this training in support of DHHS's goal of implementing evidence-based care, not for marketing or promotional purposes. Providers have an obligation to obtain a permission agreement directly with ASAM if the provider wishes to advertise or market their use of ASAM criteria.